Joining us right now on the line, one of the folks who would like to replace Arlen Specter in the U.S. Senate. He's Congressman Joe Sestak. He is from the eastern part of the state. He's a Democrat, called a moderate liberal. Would that be an accurate description?
I think better term is pragmatic.
Okay. All right.
It happens to land me in the middle of the Democratic Party.
Well, I was looking at one of these political websites here that kind of rates people on their various candidates on their positions, and they described you as a moderate liberal. I mean, you're a pro-choice, for example, and so forth.
Yes.
But on this issue of the health care bill, the CBO just came out, Congressional Budget Office, nonpartisan, just came out with this estimate from the Senate Finance health care bill of a cost of $829 billion. So could you give a reaction to that? Now, I know you're not already in the Senate, but you want to be in the Senate. So react to the Senate bill, if you would, please, and then we'll talk about the one in the House.
Absolutely. The $829 billion, which came out of the Finance Services Committee, is deficit neutral. In fact, what it also said is it reduced the federal deficit by $81 billion over the next 10 years. Now, while it's a decent step, there's several things that I don't agree with in the bill. First off, it's going to leave 17 million Americans uninsured.
Now, who are those 17 millions, by the way?
Those 17 millions are a mixture between those who could afford it but will decide not to.
Okay.
And will have to pay some penalty, and those who cannot afford it. But they're all American citizens in that number I gave you.
Mm-hmm.
Second, what it does is it taxes to get part of the revenue to make it budget neutral. The employer-based tax plans that are of a higher value. Now, it taxes the insurance companies, but it's going to be passed on. The problem with the bill is that it indexed this tax to consumer price index, not to health index, which increases about 8% this past year versus about a 3% on the consumer. So eventually, lower middle income people and their types of plans are going to get caught up in it. So the indexing was done wrong. And third, it actually incentivizes businesses to hire those who are not of lower income. What it does is it says, look, for those up to 400% of poverty, to help get your coverage, we're going to subsidize you. Now, employer, if you don't have employer-based health care plan, but you hire somebody that the government is subsidizing, we're going to make you pay for it, essentially. So what the business will do will turn and only hire those above 400% unemployment. And finally, it doesn't do enough to discipline the cost, the rising cost of health care. In short, it doesn't break up the OPEC cartel in Pennsylvania, where two insurance companies have 70% of all private health care plans by giving an option out there. And in our bill, it's called the public option that makes competition better and lowers prices over time.
So you're now in the Congress, where you're a congressman from the eastern part of Pennsylvania, in the congressional bill, the Democrats' bill. That's your party's bill, which you apparently support.
Yes.
There's the public option. So is the public option make or break as far as you're concerned?
I will have a very difficult time voting for a bill that does not have a public option because, according to the Department of Justice criteria, 92% of all health insurance markets in America are in what they call a non-competitive bidding pricing market. Take where I live. 42% of all Pennsylvanians live in the Philadelphia media market. One company has 70% of all the private health care plans there. It's almost a monopoly. So if you don't have the public option, which, by the way, the one I support is not funded by the government, only by the co-pays and the premiums of those who join it. Second, it doesn't have the high cost of paying a CEO $23 million, $70 million severance pay, high advertising costs, huge profits. You then, according to the Congressional Budget Office, save $150 billion. And that people will have, those Americans who choose to join it, if they choose to join it, but they'll go there because the cost will be less. They won't go to the insurance companies where they're paying these higher administrative costs. And all of a sudden, those cartels, those monopolies will say, maybe I shouldn't be paying $70 million severance pay to my CEO because I want that person to come to me.
But why not attack the issue, as you yourself pointed out, why not break down the barriers to what is it, intrastate? I would, competition with the private insurance companies.
I think that's a good idea if the following is done. When you break down those barriers, you must have a minimum level of benefits established nationally. Here's why.
Okay, so do that.
Yes. Well, what we did is addressed it a different way. In the public option, any insurance company that puts out a plan, and this is for those individuals who aren't covered today, and they can pick Blue Cross, they can pick Cigna, they can pick the public option. All those healthcare plans will be a national pool. They will be actually a national pool that they spreading the risk across America. So we do that, but in a different way. If you did it your way, here's what you have to keep in mind, though. Let's take Alabama. There might be a race to the bottom because all the insurance companies have to domicile their headquarters in one state. Many states do not permit you to appeal an insurance company's decision. So if you're a Pennsylvanian and you take an insurance company's policy that's domiciled, let's say in Alabama, which doesn't permit you to appeal, or doesn't mandate that it has to provide maternity services, or doesn't mandate that it can deny pre-existing conditions, then you're susceptible to where the insurance companies tend to go. That's why you could do it your way. It's a different way, but it isn't, I believe, the best way. Well,
yeah, okay, but I don't want to get bogged down in the minutiae here. I was just thinking if you're writing an overall bill, you could simply write a bill that says the insurance companies will have a minimum standard of benefits, and then anything above that will cost more, and it will be up to private individuals to decide whether they want to pay more.
And that's what we do in our bill.
Okay. And the other thing that you can do is say that here are the standards that all insurance companies must adhere to, not only in terms of levels of care, but also in how clients, subscribers are to be treated. And just problem solved. It seems to me. And the other thing why isn't tort reform part of these bills?
The tort reform is not part of the bill because right now, per studies, we know that tort reform, according to the GAO, Government Accounting Office and Congressional Budget Office, account for probably 1% of the cost of the increase in cost of health care.
But that's still a lot of money. 1% of, what is this, $1 trillion business here or whatever, or more? That's a lot of money.
But if I can give you two facts. A study was done also that said 3 out of 4 times that a case is brought forward in malpractice, 3 of those 4 times it's fraudulent. But what that study also said was only 1 out of every 10 that could legitimately be brought forward is legitimate. So I have a hard time in the United States of America saying that the government is smart enough to say that a young boy who, because of an exam, because of an operation, becomes quadriplegic, that you will limit how much money he is, let's say $250,000 or whatever.
Okay,
I think you should have your day in court.
Congressman says, tort reform doesn't mean that you can't have your day in court, but Congressman Joe Sestak is with us. He is a Pennsylvania congressman from the Philadelphia area, but he is running for Senate. And since Arlen Specter is, let me check now. He's a Democrat now, as far as I can remember, unless he's changed his mind again.
You'll have to tell me.
But anyway, so Congressman Sestak is running to unseat Arlen Specter. If you can hang on, I want to talk to you some more about the health care and also about the race.
Pleasurable.
Great. Congressman Joe Sestak with us, and we only have a few more minutes with him, and then we'll go to open phones, and you can comment on what you've heard. Phone number 412-333-KDKA, and Dollar Bank Instant Access by going to KDKARadio.com. Back in about 3 minutes from right now on News Radio 1020 KDKA. Congressman Joe Sestak is with us right now, and he is running in the Democratic primary to unseat Senator Arlen Specter, who at the moment is a Democrat. Used to be a Republican. Before that, he was a Democrat, and who knows what he'll be tomorrow. Joe Sestak is with us. And let me take a quick call here from Susan, because I think she has a good question here. Susan from Penn Hills, you're on News Radio 1020 KDKA.
Thank you, Mike, and thank you to your guest.
Okay, question.
I didn't hear you at first.
Okay.
I really have an important question. I am an independent contractor. Are you there?
I am.
Yes, we're here.
Okay, I'm an independent contractor, and I'm looking at my statement right now, $80 a week for me. Can this public health plan help me? I think this is egregious. $80 a week for me, who goes to the doctor once every 2 years.
All right.
Absolutely. First off, when you go to a doctor, we are removing all copays, zero copays for any preventive screening in the House bill. So a mammogram, zero copays, because we want to catch your disease early, and not only do you have better quality of life, but the cost of any operation is a lot less to society. Second, we will limit, even if it's a catastrophic illness, you will pay no more than $5,000. Third, we will subsidize anyone up to 400% of poverty level on a sliding scale to ensure that you can be covered. So if you fit in those areas, that's where we cover you.
Now, are you talking about the public option
No, I am talking about, here's the key thing. The public option is identical in what it must do as the mandate we have that all insurance companies have to meet the same minimum benefits that a congressman or woman has. That's the standard.
Okay, and I'm glad you mentioned that, because my next question was, a lot of people keep raising this issue with me, both on air and off air. I could buy into this if the congressmen and the senators will agree to accept the same thing. Why won't Congress do that?
I mean, here's the issue.
Well, that's not my understanding.
The public option, I just want to make sure that everyone understands, the public option, nobody has to join it.
Okay.
It's a choice.
Okay.
But the public option has to meet the same requirements that Blue Cross Blue Shield and Highmark will. It has to provide the same benefits. You cannot deny anyone for pre-existing conditions at any other health care plan.
But people want to know are the congressmen and senators and the executive branch, are they going to be having the same health care?
Whatever plan they take, they will have the same exact one, because they're going to be identical. So I would gladly join, and I voted for an amendment that said congressmen and women should join the public option. It's a choice. Now, doctors... When I was in the military for 31 years, I retired as a Navy admiral. I did so because my 4-year-old daughter had glioblastoma, brain cancer. Now, and so I want to be clear that I'll join every plan hires certain doctors to be in it. And if her doctor, who takes care of her post-treatment, she's 8 today, and only 18% of the kids ever survived this. It's the same tumor as Ed Kennedy had. If that doctor's with the public option, as long as he's there to take care of my daughter, I join in a heartbeat. Why? Because it has to provide the same care as any other insurance company.
Let me. I know we have to let you go here, because you have a time constraint here.
I'd be happy to come back.
I was going to say I would love to have you back, especially if you're going to be in Pittsburgh. Come to the studio and spend an hour with us.
I would. I was just there Saturday all day, and I was just there on Monday all day. Would you mind if I came back?
When do you want to do it?
I think I'm probably going to be there next weekend, okay? And I'll get you the date right afterwards. I'm coming out there in Pittsburgh a lot.
Yeah, weekends, though, I'm not on the air. So.
I'll make it on a day that you're there.
Good, okay. All right, but on the issue of the Congress and the senators and the executive branch, I think what people really are thinking is they're going to have a better plan than I'm going to get.
No.
You say no?
Absolutely not. Every plan has to meet the minimum benefits that we have access to as Congress members. Now, if you want more benefits, you can have them. You just have to pay it out of your own pocket. So what we've done is taken rationing away from the insurance companies, where they decide whether they will provide maternity services, where they decide whether to turn away anybody for pre-existing conditions. We say no. The same benefits that Congress members have in the federal employee health care plan, which it isn't a separate Congressman, all federal employees have it. That's the minimum level of benefits that's in the House bill. Now, everybody has to meet that. If you want more, pay for it out of your pocket. But we did not. You know who rations our health care right now? The insurance companies. I had a woman who came into my office with cervical cancer. The insurance company denied her the type of chemo treatment that her doctor wanted to have. I had a couple that came in with a young boy with stunted growth. Hormone treatment of a certain type was recommended by a doctor. The insurance company denied it. We remove that and say the benefits are all equal. The public health care plan, the only difference, we should have called it Blue Cross Blue Shield Junior instead of public option. The only difference is, because it's not subsidized by the government, it's a choice, is that we are going to find someone like Secretary of Defense Gates, except someone who knows health care that is willing to run it for $250,000 rather than $23 million. We're not going to advertise it at exorbitant cost. And the profits, no. We don't need profits. We just want a choice. So these monopolistic insurance companies owning 70% of all private health care plans in Pennsylvania begin to have to compete and not just reap benefits, not just ration care, and not just pay executives $70 million severance pays. Nope. This restores pricing fairness to the market so that if you have health care plan today, you should want this because 14,000 Americans have private health care plans every day lose their health care plans because of rising costs. That's the equivalent of Bethlehem in 1 week, Reading the next, and Allentown the next.
All right. Congressman Joe Sestak, you're welcome back when we can arrange it. Congressman Sestak is from eastern Pennsylvania, Philadelphia area, and he's running against Arlen Specter in the Democratic primary.